Welcome everyone to Healthy Bites. I'm David King with my co-host Dan Arntz, president of Eckoh. Today we'll be talking about removing risk from the payment experience in healthcare. A little background on myself: I'm the chief technology officer at Flywire. I oversee our healthcare platform. I have been involved with PCI, the Payment Card Industry Data Security Standard, since 2003. I like to say a lot of people can throw tomatoes at me as I help form a lot of the rules and regulations around PCI over the years. Flywire is a participating organization on the Standards Council, and we get to review and provide feedback on the upcoming standards. Dan, a bit about yourself.
Yeah, great. Thanks, David, very much. My name is Dan Arntz. I'm president of Eckoh. We're a publicly traded company, actually based out of the UK. I've spent the better part of 30 years in the payments industry as a whole. I started out at First Data Corporation, leading a group of people over there. And then for the last 5 years, I've been at Eckoh, where we provide a variety of services around the payment space. And our company's also been on that advisory board at the PCI Council for the last 11 years. And we're always happy to participate in that as the never-changing role of PCI continues to march forward. So happy to be here today, and thank you so much to Flywire for giving us this opportunity to talk with your folks today.
Excellent. Thanks for joining, Dan. Well, I think between the two of us, there should be very few questions we can't answer given our experience in payments. So, so first off, for our listeners, Dan, who might not be familiar with Eckoh, can you give an overview of the company, its history, and the value you bring to your clients?
Absolutely. Eckoh, we've been a business for about the last 21 years. As I mentioned before, we are a publicly traded company out of the UK, and we started out really in the customer experience space, doing a lot of things to help customers have better conversations with their customers. So, and then about 10, 11 years ago, many of our customers started taking more payments online. And as we all know, in the EU and in the UK, they've been pretty much ahead of us in terms of PCI compliance. And so when we started having to worry about our compliance efforts with what we were doing with our customers, we thought, what a great idea to take this forward as a product. And we brought that over to the United States here about 6 years ago. So really, if I netted it down, what are we all about? We're about bringing great customer experiences to our customers and then giving them a secure payment platform in which that they can securely take payments across a number of different channels and different spectrums for their customers. So that's a quick and brief description of what we are about.
Excellent. As you've been working in healthcare too, I've always called healthcare a target-rich environment for hackers and security breaches, right? We've got PHI, PII, and as you mentioned, we're processing payments, and more payments are being either done over the phone or online as COVID impact hit us. Can you describe how Eckoh approaches the healthcare industry and helps reduce security risk during the payment process?
Absolutely. First of all, I guess what I do want to do is the last year's been quite a year for everybody. And when I look at the heroes, there's a lot of them. But when you look at the healthcare space, nobody's stepped up more in this country and around the world than the healthcare providers. So I just want to give a thanks on behalf of Eckoh to all those people who have made this world a little bit safer place and really provided the level of care and nurturing that this country and other countries have really needed. So I much appreciate all the work that's been done there. In terms of PCI and security in the healthcare space, you're right. It's very much a target-rich environment for people with bad intent. And you talk about PII data and you talk about financial data. When you look at what hospitals and healthcare organizations do, they're always gathering an abundance of data on people. And some of it could be social security number related, and then they have to take a payment. So a lot of it's in the payment space. So as we look at those two together and people who have bad intentions, the combination of that data is very valuable in the dark web and other places. So we take a look at the healthcare space as vitally important to help them lock down that environment. So as we look at those things together, you got to remember that people are coming into healthcare providers are usually in a fragile state. They have something going on in their lives that's not so positive. So we want to bring our experience at giving those customers, the end customers, the patients, peace of mind as it pertains to PCI DSS, and giving that information in a way that is secure. So, and we'll talk a little bit more about this later, but with our company, the secret there is to provide a very, very secure environment for people to feel good about giving that information out and making sure that it doesn't get out into places that it shouldn't be. So we really stress in our company about it's too late if you've already got the data in there. We more worry about keeping the data from ever getting to that environment in the first place. So when it comes to the healthcare world, we really try and focus on eliminating the opportunity for bad intent to happen within those environments. So that's kind of how we take a look at it.
Excellent. Yeah, you could say to make fun of an old MasterCard joke, if I had the PII and the MasterCard number together and I'm a hacker, that data is priceless, right? So
indeed.
All right, I wanted to talk in particular about PCI compliance. In our past conversations, you said that just because an organization is PCI compliant does not mean that they are without risk, which I believe is incredibly true, right? You have to be vigilant all the time. Can you dive into that a little bit and also explain in general how Eckoh approaches PCI compliance?
Yeah, absolutely. And you're right. That is how we look at things here at Eckoh. As we all know, the PCI Council is ever changing. It is not a fixed set of rules, policies, and procedures, but it continues to change. We've all been around and seen the evolution from PCI 1 to 2 to 3. We have 4 coming out very shortly, and you can bet your bottom dollar that PCI version 5 will follow thereafter. So it's a constantly moving and evolving set of standards in which people have to apply themselves to. That being the case, the way that we take a look at PCI is really around the concept of future-proofing yourself. So we believe strongly that rather than constantly trying to hit a moving target, take the target out of the equation. By that I mean find a way to never let the data in your environment in the first place. There's all kinds of things in PCI that you can do today called compensating controls that allow people to find alternate ways of trying to secure that data or keeping data from getting into the wrong hands. Our whole take on life here is if I keep the data from ever entering that environment, then it doesn't really matter what the PCI Council changes. If I don't have data in my environment, I really don't have to worry about what I do. And I don't have to worry about constantly monitoring what's going on with the council and changing my internal processes to match a changing environment. So we really believe that if the data is never in there, and by in there, what I mean is your agents can't see or hear the data, your network doesn't have access to the data, your call recording can continue on doing what it's doing and offering that great customer experience or patient experience. So that's how we take a look at it. And in particular to, the healthcare group, over the last year, billions and billions of dollars of revenue have been lost in this space. And for, we all know the reasons why. But when you talk about revenue cycle and making sure people are getting paid and making their payments on time, I just think that having an environment like that it's key, where people are all already in a fragile state, and then you're working, you've got to get them on the phone. Maybe they owe some money to the healthcare organization, and I think that when you look at that, don't make it difficult for people to take that payment. But from an overall PCI DSS standpoint, keep the data out from the beginning, and then you're not trying to hit a moving target. So that's kind of our thinking around that.
And that's the secret sauce, right? Keeping the data out while letting the staff be able to do their job and providing a great patient experience, and making it seem like the data is there so they can serve it, but protecting it all. So that's a great solution. So at Flywire, we're laser focused on helping our clients deliver on their customers' most important payments. Obviously, ensuring that those payments are being made are secure is a critical component of that. And in healthcare, it's even more mission critical because of our client's customer. As you said, the patient, they're in a particularly vulnerable state. I didn't plan to tear my ACL as an example. In this conversation, I wanted to take a moment to pay particular attention to the patient. From the lens of the patient, can you talk about the benefits that Eckoh brings to the payment process?
Yeah, it's really on about 3 different areas there, Dave. It's a great question. One, what we've already talked about before, people are in a vulnerable state when they're dealing with their health, right? Loved ones in a bad state, they're in a personal bad state. So you want to make this as simple as possible. And we've already learned from several of our customers when they call in and using, the Eckoh system as we do it today and taking the payments in which we do, they are very appreciative of the fact that you're not having them read credit card data aloud over the phone. It gives them a sense of security. What we found is people are very much appreciative. We have call recordings of customers actually saying, "I'm so glad you're doing this. I never felt comfortable leaving my information out in the open anyway." So that's the first thing is it shows them that you care. And people do pick up on that. As a matter of fact, if you read some of the latest trends out of some of the payment magazines, if you take a look at companies that have had a breach, the initial impact after that breach, they lose about 3.6, 3.7% of their annual turnover or sales in that case. Healthcare is even more because people take that even more seriously. The latest statistic shows 7%. So, putting that customer at ease means a lot to that customer. So I think that's the first thing. Second thing is, customers are really building affinities to how they make payments. And this is one thing I call channel of choice. So if a customer's on the telephone talking to you, don't make them leave that telephone to make a payment. If they want to chat with you and they're over a chat channel, don't force them to go someplace else to take that payment. So it's important, I think, in the customer's viewpoint to not only be able to execute that transaction, quote unquote, in that channel of choice, but people are also building real affinities to the payment vehicles of choice. Okay, there's lots of different things out there. You've got Apple Pay and Google Pay and PayPal, along with the different cards and ACH type things. Let them stay in that channel. Let them pay with the instrument of their choice. And I think together, when they're already in a vulnerable state, they feel good that you're taking my payment in a secure manner, and you're letting me pay that in a way that I'm comfortable doing it. So I think from a patient standpoint experience, those three things together make a big difference to the healthcare community.
Excellent. Tell me how Eckoh was impacted, or how did you have to respond when COVID hit? Obviously, you went focused on like larger call centers, with the patient staff in the facility dealing with all the patients. Then all of a sudden, everyone was distributed home, but they still had to provide that level of service. I imagine that had to impact Eckoh, and you had to step up in unique ways there.
Yeah, I will say last March through May, my phone was constantly ringing. We did a lot of proactive work with our customers because everything changed, right? You had people with large contact centers or working in environments where everybody was in a brick and mortar environment. And then the next day, they had people working from home. So people were concerned, saying, how do I know that I can still keep the controls around my payment process and keep it safe and secure? I'm worried too much right now just about getting technology delivered to their dining room table or wherever they happen to be working from. And so we proactively reached out to our customers. And I would guess I'm pleased with our company because we try to provide technology solutions that are looking into the future. So the good news for our customers was when they called, I said, nothing changes. So if you are now from a work at home environment, it doesn't change how you're consuming our product. And you can rest assured that if they're working from home or working from a brick and mortar environment, you're going to be in good stead. So when we also look at, some of our customers, we have a large healthcare contingent. We have lots of people in the hotel, motel space, travel. All of them were concerned about how does this change my customer experience and my ability to pay. And I guess the good news was we walked them through that, and all the customers were quite pleased that they didn't really have to change their processes in order to take a payment securely.
Excellent. So as we enter the first quarter here of 2021, well, we're halfway through it, what advice or key takeaways would you give to healthcare systems or clients in general as they look to evaluate and set their security protocols for the rest of 2021?
Yeah, that's a really good question because we're getting a lot of those right now. A lot of people calling saying, we've survived the barrage. Now, what do we do? How do we even be more secure? I guess my first take is be deep and wide. Don't look things in a single bucket. Extend your search over we come in at what I call that initial contact with a customer. or on the back end when you're trying to collect. So I would say look deep and wide. Don't look at solutions in a bucket, but try to say, if I'm going to protect my customers' information, both financial and PII, let's do this right the first time. So, I would say consider working with people who can do more than just secure a payment. Look at things that allow you to secure other personal identifiable information. Don't try and, skate to where the puck is going, using a hockey analogy. Take a look at these things and say, where do I really want to be a couple of years down the road, and try and go towards that environment rather than a single point solution. Secondly, I'd say keep your patient in mind. As we talked about several times already, they're in a vulnerable state. They're concerned about certain things. Make it easy for them to do business with your healthcare organization. Meet them on the road that which they wish to travel. And I think if you look at those two things together, you'll be positioned well for now and in the future.
Excellent, Dan. Well, I appreciate your time and joining me today. It's been a great conversation, and to our listeners, hope you learned something new today. So have a great day, everyone.
Great. Thank you, David.